Thank you very much, guys. I'm again live with you. This is your wish. You want to see me live in some videos. I have been doing some videos for you, and this is a special video. A patient has sent me the picture, and he want to get himself corrected at the crown. He was done surgery at the crown and by some non-doctor again, and this has been produced at the ground. No direction, angle, everything is changed, and you see bunches of grafts in the crown area and giving totally unnatural looks in the crown area. And he moreover he is teacher and been teaching in some medical school, and he came to me for this purpose to get this corrected. I was not available at that time, and he sent me pictures so that I should be giving him some good advice. So, advice for you people is especially don't go for hair transplant surgery to the technicians. This is first advice, because when and other advice is when you are going to do surgery, especially for the crown area, this is a very special area because the angles at the crown changes. It changes with the direction as well. I'm sorry to say. In this direction, the angle is very acute. In this direction, acute. Here the angle becomes a little bit wide. So this is about the uh, angle and direction. You see in the crown area, direction changes with each and every graph. So that, yes, thank you very much, my producer. She has done something like she has done a little bit zoom to this picture so that you can everything could be visible to you whenever we are doing video on this. You should see what is going on here. So my advice is when you are going to get the surgery done in the crown area, you should be looking for best doctor for yourself, because he should be knowing how to create a wall in the crown and how to give angles to the grafts at the crown. This is very important, and direction as well. So three things you should keep in mind while doing hair transplant surgery as a doctor. While doing hair transplant surgery in the crown area, you should be keeping in mind three things. Number one, it should be accurate angle, accurate direction, and how to make it work. This is very, very important to do a surgery in the crown area. What I do is I take my time, I give my full concentration while doing it in the crown area, while making the slit especially. And I introduced a video, I introduced a technique to do the slits in the crown area. I asked the patient to lie in a prone position, and the doctor could find a very good angle, a very good direction and angle of the wall seen in the crown area. Because while you are putting the patient in the prone position, you will be like having this area as your frontal line, and from here you can make the wall very comfortably and easily while doing the crown area. So especially what I will be doing to this patient, I will pick up excise few grafts. This one I will excise few grafts from this area. This one, 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 and divide these grafts into single follicular units or two follicular units and put them accordingly, because I will put 2, 3 in this area and single follicular units from this area. So I would go for this, that I would go with the, as we do in the frontal area, we put single grafts in the frontal line, and then we keep on increasing the density with the multiple unit grafts. So same will be happening here. While starting from the wall, this is wall, we will be going in the directions, and from here to this, I will keep increasing number of hairs in the follicles. So bigger follicular units will be in this direction, starting from single follicular unit. So this would be my idea, and I would suggest to you as a patient, when you are going to get the crown area done, especially, you should be looking for the best doctor for yourself, because he must be knowing how to do the crown area, because this is a special entity. You need a good amount of hair, you need a good age of the patient, because you cannot do the crown area in 20s, early 20s, or like early 30s even, because first you will go for the priority area, and priority area is always the frontal area. You will complete the frontal area, and then you can opt for the crown area, because you have limited number of grafts, limited number of safe grafts or permanent grafts in the on back of the head, and you need to know the best utilization of those precious permanent hair available on back of the head for whole life, because when the patients are coming to you in the early ages for hair transplant surgery, you should be knowing that if he is bald in early 20s, mid 20s, or even early 30s, then what would be happening to them in coming ages? And don't forget ever to prescribe finasteride and minoxidil along with the surgical procedures. Whenever you do the surgical procedure, you should be keeping in the medical treatment as well, so that we should be doing something to prevent the hair fall in coming ages. So my advice to my patients is, please keep in mind you should be going for a good doctor, best doctor who is qualified, skilled, and having a good surgical technique whenever you are going for hair transplant surgery. Thank you very much.